Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
When you have different sperms coming in every 1 week or every 1 month, you're confusing that uterus, and that is an invitation for dangerous diseases to set on. Okay? I'm not gonna name, but many diseases, the uterus get confused, and you will have a bad uterus, and you will have a bad diseases. Okay? Yeah. It has been now researched why we have so much fibroma. Women with multiple partners without a break, it can also be a reason. It's under research, but it has not yet confirmed. Anyhow, those data are valuable online if you like to confirm anything that I have said. Anyhow, those are medical research that has been studied and approved. So my advice is this is beside, you do not know. You're gonna, you will have a child and you do not know who's the father. And you will say, okay, maybe the father is the one I slept with in January, or maybe the one I slept with in February. Does that make sense? It doesn't make sense, because now science is very advanced, and very soon DNA testing, parenting testing will be introduced into Cameroon. I'm quite sure it already exists, and very easy to know if this is the father or this is not the father. And there's many cases that we have encountered that the father is not really the father, right? So now, nevertheless, so summary, uterus have memory cells. Advice, have a break. If you're gonna change guys, have a break between one guy and the next, not less than 3 months and 10 days. Okay, now we finish with the desire disorder, and we mention what to do. Whether if it's physiological, we're gonna give testosterone. If it's psychological, and this is the most commonly existing, whether it's a man or a woman, then the psychotherapy and counseling by a sex therapist will be the optimal, and you will get a fine resolution. The next phase of our sexual dysfunction, men or women, is arousal. What is arousal? Excitement. So what is the hallmark of this phase? In a man, you will have erection. In a woman, you will have lubrication. The vagina becomes wet. I got those questions from the last session. Doc, I have sex, but is no lubrication. Even though I'm excited, but there's no lubrication. So I told her, check your glands. Massage the sides of the vagina. This is the Bartholin glands there. Massage, maybe the canal is clogged. If you feel a small swelling on the side of the vagina, that means the gland is clogged, because those glands are the one responsible for secreting that lubricating material, okay? That mucus material that is being lubricated from those glands. Massage the side of the vagina slowly in a circular motion, and if it's clogged, it will be unclogged. Sometimes we have issues in those glands on the side of the vagina that this place becomes a swelling, and that was also another question. Do not worry, it's a very small thing. Unless you ignore it for long and it becomes so big and it collects pus, then in this case we have to aspirate or incise and drain it out. How we know which procedure we will make? By simple ultrasound. Ultrasound will show me what kind of fluids are there, if the fluids are free fluids easy to come out, or the fluids are semi-solid that require us to open a small incision and drain it out. Ultrasound tells me a lot of things. a lot of things. But if it's a small swelling and you are dry during the arousal phase, could be one of the reasons. One of the reasons. Now, also, ask yourself, have you had a cold and you've taken antihistamine for that cold because you have a runny nose? Have you this tablet before you had sex or a couple of days, or you've been taking it for the last couple of days? That also could be another problem, because antihistamine dries you out, and including the vaginal lubrication. That is why you, during excitement phase, during the arousal phase, you cannot get wet enough because of the drug you're taking. So look at the medication that you're taking and read them and see if they interfere with, the lubrication phase. Especially we're talking about the antihistamines, that medication you take when you have a cold. Okay, when you have a cold, that is called antihistamines medication. It has antihistamine in it. Now, we also mentioned before, we said, impotence or sexual weakness could be a sign of depression, right? We said it could be a sign of depression, and most likely it is a sign of depression. And we treat depression with antidepressant. And here's the news. Some of those antidepressants that you take, if you don't go to a specialist or to a doctor who understands, some of those antidepressants in themselves, they cause sexual weakness. Some of those antidepressants that you take for depression cause sexual weakness in a man and a woman. So what is the solution then? You said sexual dysfunction is a sign of depression, and we treat depression with antidepressant. And now you're telling me antidepressant could lead to sexual dysfunction. So what is that? Well, there are groups of antidepressant. If you care about your sexual function, then we will give you an antidepressant that does not interfere with sexual function. But if you, an old person that gave up on sex, don't have sex for years, then it doesn't matter in this case, which category of antidepressant we choose. But the doctor would know. It's not you to know. The doctor would know which class of antidepressant that will be good for you and does not interfere with the sexual function, whether a man or a woman. Okay? Now, so we say, if you check, you're not taking antihistamine, you're not taking antidepressant, and the glands are all fine, there is no problem with the glands, and you're still dry, then maybe we can use some lubricant, local lubricant, okay? And remember, if you are taking the birth control pills for sometimes, it causes also some kind of dryness. It causes some kind of dryness. And we said the best solution also, to very simple solution, is we put that estrogen pills. A lot of people, where can I get estrogen pills from? You go to your doctor, explain the problem, the doctor will give you, the doctor will write it for you. It's not like you're gonna find it on the side road. Maybe in Cameroon you find it on the side road, but it's not good. I get men, okay, and I will discuss it now before I forget, because I know I'll forget. Now that's in my head. I got some patients, okay, and doc, Viagra is not working for me anymore, and I don't like to be in Viagra because it gives me this, it gives me headache, it gives me this, it gives me that. I said, okay, just out of curiosity, how much did you pay for that Viagra? Oh, 500 francs. For how many tablets? For 4 tablets. That's 125 francs for a tablet. I said, what Viagra is that for 125 francs a tablet? You bought it from a pharmacy? I said, no, not from a pharmacy, from, So, okay. Well, I did a hormonal test on that guy that he bought it from, the side road. And I did a hormonal test on him, and his FSH, as I remember, his FSH was high, testosterone was normal, and LH was normal. So he only got high FSH, normal testosterone, and normal LH. You know what that translates to? Translates to spermatogenic failure. The testes are there, is making the testosterone, but there is no spermatogenesis. There is no sperm. You cannot make sperms. And most likely the reason is those Viagra. That is not Viagra. I'm sure it's not Viagra. It's something else that destroyed the guy's testes, and they call it Viagra for 500 francs. I mean, there is no Viagra for 500 francs for tablets now. Never existed. Not even in a different planet where they have everything for free. It doesn't exist. So know what you're taking. Take the package, Google it, and see where it's coming from now. I'm quite sure it's fake. Anyway, this is just one of the, a lot of you know about the 4 tablets Viagra for 500 francs. A lot of you do, because I ask a lot of patients. They all have the same thing. I cannot take phone calls. Please do not call. I will try if I get time to answer the questions, or I answer them in the next session. Okay, so let me move to the next phase. We said there's 4 categories of this, of those sexual dysfunction, men or women. Now we have orgasmic disorder. What is orgasmic disorder? I cannot reach the peak of pleasure when I'm having sex. Some women, I never had an orgasm. I do not even know what orgasm is. So if we say communicate with the husband about your, remember we said once, a good communication, which is I talk, you listen, you talk, I listen. This is called communication. A good communication about a man and a woman, is very essential for the success of a relationship, sexual relationship, right? So you tell the man, this is what I like and this is what I don't like, and the man tells you the same. So what if you don't even know what you like? If you don't know what orgasm is, what orgasm feel like, that means you have never known where is your sensitive spots, where the man's supposed to touch or manipulate, or you don't know because you have never experienced an orgasm before. So now what is the next step? What should I do? Well, it's very simple. You have to be aware yourself of your sensitive sexual spots, or we call it the G spots, or the spots that arouse you the most. You have to be familiar with, and then you'll tell him, this is what I like and this is what I don't like. But you do not know what it is, then it's not. If you yourself do not know where it is or how it's supposed to be exciting you, then how would he know? You cannot even communicate because you yourself don't know. So what is the solution? The solution is, I said everybody masturbate, no? But it has to be to a limit. It has to be to a very limit. You cannot exceed, otherwise it will be pathology, right? So during masturbation phase, you will know what is the spot that gets you on the most and what is the most sensitive spot for you. And this is what you communicate to your man. And you cannot be shy. And the man also cannot be shy because you both at one. It takes both of you to have a successful sexual relationship. So if I hide my likes and he hides his likes, we're they're assuming. And the next step will be, I'm with my man, but fantasizing about someone else. And he is with you, but fantasizing about someone else. So this is the beginning of the disaster. If it continues for long, the relationship will not survive long, right? I think you know what I'm talking about, and everybody now having in their head exactly what I'm talking about. You're probably saying to yourself, oh yeah, you're right, doctor, you're right. This is exactly what's going on. I know. So now, what is the solution for orgasmic disorders? Education. Education. You have to have education about how to have an orgasm. And we said the difference between a man and a woman is the woman is multi-orgasmic. She can have multiple orgasms during one sexual intercourse. And the best thing to have the woman have multiple orgasms is the foreplay, the arousal phase has to be extended as long as you possibly can. The man as well. If you have a premature ejaculation, we told you that there is a medication you take to prolong the ejaculation, but this is not what I want. Because like I said, sex is all above the shoulders. Sex is in the head. So what can I do to have, delayed ejaculation, to take my time when I'm with a woman? Well, we're gonna help you with one of those tablets you take before sex, okay? And that will delay the ejaculation. That will delay the ejaculation. But meanwhile, you have to be conditioned. Your brain has to be rewired, to delay the ejaculation. Like I have mentioned,